Ladies and gentlemen, we have the title of our presentation, which is Restoring Hope in the Face of New COVID Adversities of the COVID-19 Era. We are presenting here on behalf of a child rights organization in Lesotho, which is known as Bahlabani. And we are going to be presenting towards the end of this event how we have been trying to build back a better Lesotho feed for children and youth. We have 10 strategic areas of operation as Bahlabani Initiative. We work in the areas of alternative care, in juvenile justice for children. We also do research, child rights research for informing policy, legislation, and programming. We monitor and report on the implementation of the child rights instruments in Lesotho. We are involved also in public finance for children, which is about investing in children. We also do child rights training and capacity building, and we develop child rights indicators that are relevant to the monitoring of the child rights situation. And we promote the child rights to play and strengthen and professionalize the child and youth care workforce in the country. We rely heavily on the strategic partnerships and collaborative linkages that we have nationally, regionally, and globally. We'll begin by giving a snapshot of the demographics and the situation of children in Lesotho. We have a total population, an estimated total population of 2 million in the country, and 51 of these is made up of children and youth. We have the 0 to 17 age children who constitute 10 to 13% of the population. And the country has for a long time, for almost 3 decades, having the second highest HIV prevalence globally. And that posed a lot of challenges for children. Children, for instance, 1/3 of them were orphaned due to largely AIDS-related deaths, and therefore they've been deprived with parental care and love. The country before COVID was already ravaged by endemic poverty, food insecurity, and high employment rates. And these were fueled by environment-related shocks, the political instability, and the decelerated economic growth that we have, that have marked the country's landscape for decades. As a result of the situation we have just described, we have had for a long time in Lesotho common child protection challenges, and these include children assuming household headships prematurely. We have children who are living and are working on and from the streets. We have also those who are under or living with unsuitable carers. We have children who are experiencing increased exposure to human trafficking. In fact, the newspapers this past weekend, were talking to this problem of children in child labor who are also being trafficked. We have abuse of different kinds, physical, emotional, and sexual. Problems of property dispossession when the parents die are also common. Child labor and some of its worst forms like herding are a common phenomenon. We also have children dropping out of school. Now, because of the situation of children that resulted from the HIV/AIDS, we have children who have been affected and infected by HIV/AIDS, and for their survival and development, a significant number of them needed care and support provided in the broader social service system. The government therefore decided to create a child-friendly environmental situation, which was going to be conducive to guaranteeing the protection and promotion of the rights of children and youth. And to attain this, a number of policies and legislative, including strategic frameworks, were developed to guide the identification of the key response areas. Some of these frameworks were in the education sector. We also had the Child Protection and Welfare Act. We have different national policies and strategic frameworks that address children who were overseas. And we also had the Sexual Offences Act. The HIV/AIDS and related risks exerted a lot of pressure on the child protection system as well as services in the country. The concentration of the services in our country happens to be concentrated in the urban areas, and that tended to worsen the situation that we have already talked about. The majority of child protection services in Lesotho remain welfare-oriented, and prevention and early intervention approaches are not yet prioritized. Our social service delivery relies predominantly on the social service, on the social work practice. And social workers are often not based at the grassroots community and village levels where most of the people live, including the children themselves. The public service is the only sector that is able to employ social workers, as our NGOs and the institutions they run cannot afford the cost of engaging social workers. The social work pre-service training is generic and is not child focused, and that's a big challenge for us. I'll now talk about the COVID outbreak in Lesotho. And this started in June 2015, 2020. There were 4 confirmed cases of coronavirus in the country at the time, and all of these were imported. In other words, they didn't concern people who are in the country. By mid-August 2021, it has been reported that we had 10% of the people who had contracted the virus. At this time, COVID was spreading rapidly globally and in the sub-region, in particular South Africa, which is the only neighbor that Lesotho has. The 2 countries have strong socio-economic linkages. So we come and get out of Lesotho into South Africa. and they do the same all the time. So the spread of the virus became a concern. Lesotho's structural, macroeconomic and social fabric is marked by numerous challenges because of its location within South Africa. The government of Lesotho therefore had to take decisive actions to control the spread of the virus within its borders. We had numerous setbacks emerging with the COVID, and the setbacks were diverse and multiple, and they became devastating on the socio-economic circumstances of the country. We began to realize sharp increases in unemployment, vulnerability, and poverty. While the pandemic appears to have had impact on the adult populations, it has hit hardest on children and youth. And which is what we are going to be addressing in a moment. But we have to admit that we have a paucity of statistical data which can actually illustrate the magnitude of the setbacks we have experienced with the COVID. Now, in the education sector, the setbacks of COVID have been massive, and they became evident with the closure of schools and ECD centers on March 18th in 2020. The Ministry of Education and Training shows that these closures affected approximately 511,000 learners. Mostly these were learners in the rural areas. During the lockdowns, few private schools and tertiary institutions could continue functioning. And these happened to be those that had access to remote online learning platforms. The majority of learners, therefore, from this situation could not access these platforms, as the existing digital divide in our country is largely characterized by lack of electrification, network infrastructure, computers, internet, and data. Distance learning in the country has not yet become a permanent feature of our education system. Therefore, we rely heavily on face-to-face teaching and learning, even now that children go to school in pairs. The closure of schools has affected children disproportionately. It's learners from already disadvantaged backgrounds who have suffered most. These closures have exacerbated the inequalities that already featured prominently in the education system, namely exclusion of children at risk and those with limited access to quality education. This is going to have, as we can tell, it's going to be having far-reaching consequences on the country's ability to achieve this strategic development goals and the targets related to them, specifically on education and gender equality. Besides the setbacks in education, we have had other COVID-related setbacks. The school closures, as we have learned, gave access free time to children to loiter aimlessly and unsupervised. Girls, in this case, have been disproportionately affected by the school closures, which heightened risks to sexual and gender-based violence. Teenage and early pregnancy, as well as child marriages, have increased. Rape cases and transactional sex to cover basic needs have also been reported in greater numbers. This further explains the rise in the number of unwanted pregnancies that we have in the country at the moment. Many survivors of these abuses and forms of exploitation did not return to school when they reopened. And we suspect that some of these children may have dropped out of school completely and will never return to school. This is a further indication that sexual and reproductive rights have also been highly compromised during the COVID era. Now, we have examples of some of the initiatives that we have been able to engage in during this period. And one of them is that we helped in translating the COVID information booklet from English into Sesotho. The booklet was intended mainly for mothers, and it was a project that we undertook for Help Lesotho. And the content of the booklet covered various topics on COVID-19. It was about the coronavirus itself, what it means, how it is transmitted, its symptoms, issues about whether it can be cured, whether it can be prevented, and also issues about the stigma associated with the pandemic. It also talked about what the mothers could do during pregnancy, birth, and breastfeeding, how they could care for babies and children in those situations. The next initiative that we have completed was done on behalf of the Phedisanong Child Care Facility. And in this case, we developed and designed appropriate recording and reporting forms for this facility. The forms were actually for care systems strengthening and standardization of childcare practices and processes at the facility. And we had several forms developed, like the application form on when the child was applying to be admitted into the facility, the first contact form, the emergency first contact form, the child's profile, and reportable incident form, as well as the disengagement form. We are at the moment going into a project that is linked to our role as BI in monitoring and reporting on the implementation of child rights instruments. In this case, we have embarked on a project involving the development of national database for all cases of VAC in Lesotho. The focus will be driven by the concluding observations and recommendations that we got in 2018 from the UN Committee on the Rights of the Child. And it's concluding observations and recommendations that cover abuse, exploitation, and neglect in all their forms. And we are going to be cooperating very closely with the key line ministries, the Ministry of Social Development, and the Ministry of Justice and Correctional Services. The last intervention that we'd like to talk about is that concerns the BQCC, the basic qualification for childcare training of trainers, which has been organized through the NACCW and FISE Africa. And we have sponsorship from Adoption Centrum in Sweden. And we have 5 members or participants of the Bahlabani Initiative who are going to be part of this training. And the training has actually started. It's already the first week of October 2021. We have other participating countries, which are Kenya, Namibia, and Zambia. Since it's a virtual training, we will all be able to connect at the same time to partake in this big opportunity that marks the beginning of strengthening and professionalizing CYCWs and social service workforce in Lesotho. Ladies and gentlemen, just to conclude quickly, we take it that in Lesotho, we all want to see a Lesotho, a country fit for children and youth. For this to happen, in our view as BI, we have to strive to build a social service workforce that works for children and youth. We want to mobilize all stakeholders, the purpose being to amplify Lesotho's commitment to promote better care for the country's young people. Strengthening the social service workforce is at the heart of the interventions by Bahlabani Initiative in combating historical and new adversities that children face. We have learned a lot from the partnerships we have established with the NACCW, the Zambia chapter of the CCW, the FISE Africa and FISE International Adoption Centrum, and many other partnerships that we have created over the years. We have actively revived our efforts to have an association of child and youth care workers registered before the 2021. We hope that by the FISE International Congress in 2022, this is what we will have become. Thank you very much for listening to us. We have, I think the last page is just our contact details. Thank you.
Thank you so much, Doctor, for that comprehensive presentation. Currently, we don't have questions in the chat and also in the Q&A. And I just have a few questions in terms of you're talking about training child and youth care workers through in partnership with NACCW on the BQCC. And you mentioned that most affected areas are the rural areas. And are these child and youth care workers going to be coming from those areas? And are they going to be trained within those areas? And in terms of connectivity then, because you mentioned that it will be done virtually. So my question is then, will that be viable? And then I don't know whether I should ask all the questions or just ask one and then I'll have a follow-up after that.
If it's okay with you, I would like to respond to the first question first.
Yes.
In terms of the training, we have 5 participants coming from Lesotho. Therefore, they will be connected virtually because we've already organized that to the organization. But with the rollout, we'll have to come up with a rollout plan as to how we will achieve this moving forward. Because like you are saying, there are other constraints that may limit us in terms of rolling it out virtually because of other situations that are pre-existing, such as the connectivity. So with regards to actually the rollout going into the communities, we will find an alternative at how we will train our workers within the rural areas that they are already practicing. I hope that answers the question.
Yes, it does quite clearly. And thank you so much for that. It's very informative and actually helps me a lot in understanding. So one of my other questions then was around the doctor during her presentation mentioned that, it is hard for the private sector or NGOs to actually employ social workers. And in terms of training child and youth care workers, are we saying that, they are a cheaper resource in providing psychosocial services within the communities in terms of NGOs? And in terms of planning forward then with the NGOs, are they looking at an integrated approach where they bring in the social workers at a later stage?
With regards to that, what I can say, it would be cheaper in terms of the alternative of child and youth care workers. This is based on the fact that we do already have community-based collaborations within the rural areas that are already existing and have work being done with children already in the country. So our approach is that we just merely want to improve the work that they're already doing by strengthening them in terms of acquiring them training within the child and youth care, child youth care work training. And therefore, that's really empowering already existing systems in order for them to be able to now practice child and youth care work in a more professional way. Because unfortunately, in Lesotho, most of the child and youth care work that's been done has been done without any formal training, because it's women or men who are based in communities and decide to actually afford children that probably have problems, some sort of support in the communities. So basically our professionalizing and strengthening is going to be starting right at the beginning, and we'll be now training them in the child and care work field.
I think I can chip in there because it's not about child and youth care workers being a cheaper option, but it's about them having child-focused training and professional training. And the other groups of people that are already working with children have had no career path whatsoever and no appropriate training. And for us, it's better to train people who can work with the children right where they are in the communities and villages, more than to have the social workers who are few in number, because that's the reality. I think globally, it has been indicated that social workers are in short supply. So we think that if we train people who are already based in the communities and in the villages, then they'll be able to reach out to the children better. I think that's the reasoning. It's not about the cost. It's currently what we really need to work on also as we start the training of child and youth care workers is also to try and link up with government. The challenge that we have in Lesotho is that not many people even know about the child and youth care profession. So this is something that we are trying to bring out to let people know that it's not just social workers who can work with children, but it's also other cadres of the different professions that can deal with children.
Okay, thank you so much, Doc, for that informative response, and thank you, Ms.Mpepuoa, as well. And I do completely agree with the notion that we need people to work with children where they are, and work within those communities, that are often hard to reach in terms of the services that are being provided to children. And actually, what you mentioned as well was the collaboration between the government to actually promote, that there are other careers or other career paths that actually serve children in different ways, which have their own set of curriculum that they actually, or scope of practice, if I might. So I'm really grateful for the opportunity to actually engage with you on this. And also just one then last question. We left with 7 minutes. My last question is in terms of the interventions that you have already started to implement in response to the COVID-19 pandemic. And I just wanted to find out in terms of managing and dealing with myths around COVID-19 and people resisting to actually take vaccines. How have you mediated in that regard?
Doc, you want to take that one?
It's not something that we could take up on our own as Bahlabani Initiative, but we work with in cooperation with other civil society organizations in the country to try and encourage people to vaccinate. Now the challenge comes with our the topography of our country is also a challenge, because where we need to travel up into the mountain areas, it may not be easy. But I think it helps also to go around when the vaccination sites, when the Ministry of Health is vaccinating, and speak to people who are watching and not taking the vaccines. With that one, I must say we are just starting to venture into that, but we hope that more and more people will agree to take the vaccine. We have seen that with the newspapers over the weekend that in Lesotho we are now at 11%. We have passed the 10% vaccination level, which actually the WHO is saying countries should attain. So maybe it's promising. We'll see as we go by.
Thank you so much, Doc. Thank you for that response. And then I think if there's anything that you'd want to share or elaborate a little more on, this would be a good time to do so. And I just want to reiterate the fact that, NACCW will keep the recording for anyone who wants to come in and review your breakaway session. So anything that you'd want to share further, this is the right opportunity. We only have now 5 minutes left into the presentation.
Okay, thank you for that. I think all we can say is, as an organization, we foresee that there's still a long way to go in terms of strengthening child and youth care work, as well as the social services workforce. But we are always open to any advice or any kind of support that can come from anywhere whatsoever. But like as the presentation ad indicated, we hope and we would like to see a Lesotho fit for children. We would like to see a Lesotho where children are able to be themselves without having to compromise who they are. Furthermore, I think hopefully as the only child and youth care worker currently in the country, I am hopeful that in the future when we come back, we will have about many more child and youth care workers than we have today.
Thank you so much. Thank you so much for that. Do you have anything further to add, Doc?
I think it's on the support side, because we, as we mentioned, it's not many people in Lesotho who have even heard about child and youth care work as a profession. So we need support of our partners to be able to to spread this message. And I know in FISA Africa, we have talked about this, that if we have the same message going around all African countries, that would be of great help to us. We have seen that here we have UN agencies like UNICEF. We really would ask that maybe the South African UNICEF should, pass on this message to their colleagues here in Lesotho about child and youth care work and about what the child and youth care workers can actually do. I just want to give an example that we have, as we have had, one of the best child grants program. But for us, if that program is not being, if the implementation of that program is not being monitored, the money may end up going where end up not going towards the needs of the children. But I think if we have child care workers in the communities, then they'll be able to oversee what is happening to these child grants and how the child grants program could be improved. I think that's what I have to say.
Thank you so much. And thank you so much for your time and responding to my question. I do wish you a great time in the course of the conference, and please do have a great afternoon. Thank you.
Thank you.